Welcome to the Research Coordinator Enrichment Series, our September session. Today we have, as you know, as you signed up, Coordinator's Guide to Key Research Systems that we use at MCW. And here we have Jen Brown and Isabella Poles. I'm saying your last name correctly.
Yeah,
perfect. Yep.
Hi, everyone. Thanks for joining. As Sarah mentioned, today it's going to be a lot of content information, but we're excited to present this, just understanding that we have a very complex job in a very complex space. Just looking at this picture, we have 4 separate research organizations on one city block between MCW, Freighter, Children's, and Versity. That doesn't, not counted the VA and other partners, but a coordinator job is really to bridge across all of those centers. We have studies that bridge multiple study sites, and just when you're stepping into this role, awareness of just what tools are available to help you through your daily workflows, and then also who to reach out to for help. So you're not spending and trying to find the answers on your own. And now we're gonna launch a poll just to get a gauge of our attendance and recognize a bunch of names.
Yeah, and this poll is on Zoom only, so we do have a few folks in the room, which we're excited about. So you can let us know in person.
So we would love to know what institutions you primarily conduct research in, whether that's Freighter, Children's, all of the above, or other.
Same. Medical College. MCW and Freighter. Just you'll be able to see the results here. And it should.
Everyone should be able to see. We have a good mix of individuals on the call. So again, we want to make this presentation relatable to everybody. And please feel free to put your questions in the chat, or certainly if we have time to discuss at the end. And my name is Jen Brown, and I'm with the MCW Office of Research. And I will cover primarily those pieces relevant to research at Freighter and MCW. There are components that tie into efforts at Children's, and then I'll turn it over to Isabella to speak specifically for pediatric research teams. There we go. Okay. So I wanted to start with the Office of Research training page, just so everyone's aware that this resource exists, and it has a lot of relevant information. Actually preparing for today's session, we made some updates just to make sure that things were current and relevant. I'm going to hop out really quick just to take you to the website itself. There we go. So my little tip to get to this site, if you're on Infoscope, there's the A to Z guide. And if you go to the A to Z guide, go to R for research, and there's a link for research training, and then bookmark it from there. That's just my easy pathway to get to this site. This site is actually externally facing. So whether you're logged into Citrix or not, you should be able to access it. But we have a lot of great information on here for study teams. For those who fill out the Qualtrics form for when research visits occur, that form is there. We have toolboxes available, which includes information on Florence, Epic, and different tools within that site. So there's information there, information for city, what modules are required. And then one thing I will also touch on at the top here under, again, there's a link for toolboxes here, under human subjects research. Clinical research support. We have a lot of information there. And there's a new staff onboarding tab. So if you are helping onboard a new staff member, or again, if it's just a refresher that like, hey, am I missing anything? It's a nice place to go for all of this information. I'm going to take it back to our slides quick. So the onboarding checklist that we have is available on the website. It's not required, but it is strongly recommended that departments use this to help establish that training curriculum for new staff. This was developed as part of Human Research Operations Committee or HROC initiative. And it highlights what's required for within the first 90 days to 6 months. It has direct links to the specific trainings, and then there is a separate tab by role. So if you have a coordinator versus a regulatory specialist, CRAs versus a CRC2, what trainings would be recommended, not necessarily required. But this is available for teams to use. It's an Excel file, so departments also have the ability to modify it if there's department-specific trainings or other things that you find helpful to share with your colleagues as they're onboarding in their new roles. Just a great tool that this is available to use. This would be used by coordinators across the enterprise, both those working on adult and pediatric studies. Isabella will talk about some of the additional training for pediatric coordinators, but again, just a great resource that's available to help individuals identify what trainings are available, the basics that should be covered in your first few months in the role, but then also opportunities moving forward. Excuse me, with that, just wanted to touch on city course offerings. We're all familiar with the standard human subjects research courses and good clinical practice trainings that are available via city, but I wanted to touch on the ones that are in bold at the bottom, because MCW does pay additional for these modules to have additional educational opportunities for CRCs and staff within the clinical research enterprise. So highly want to recommend the CRC Foundations, which is great for new CRCs or as a refresher. In addition, there's the CRC Advanced course. That one also was just recently updated with videos to, I guess, reinforce some of the training. We also have training specific to clinicaltrials.gov registration and results reporting that has great video tutorials to walk you through that process and know that it's complicated. Sarah and I are also happy to answer questions related to ct.gov. We also invested in the clinical trial billing compliance piece. On the adult side, we're fortunate that we have OCRC to help facilitate clinical trial billing compliance, but for research coordinators, I think it's understanding the importance and the regulations around this space. So again, that city module can provide some additional insight into the billing side of our world. And then the one we just recently purchased is Essentials of Clinical Trials Budgets, and just understanding the different nuances of budgets, not just accepting the budget as proposed from sponsors, making sure you're aware of what's required to cover our costs, understanding your worth, your time, your effort, to make sure that that's factored into the budget. So again, great opportunities just to enhance your professional development. There's no cost. And certainly if you see other city modules that might be of interest, let me know, and we could always consider that for research teams.
Can I ask a quick question?
Yeah.
Are those ones at the bottom to replace the clinical trials financial management workshop, or is that
No.
they're all separate things?
No, all separate things. So, when you think of our training, we have a lot of robust different trainings through CTSI Academy. We have boot camp, we have other things. So the city is more of just your self-service, just additional content,
Gotcha.
but a nice companion to the other resources we have. Great question. Very high level, I just wanted to show this research systems integration map, because I think individuals are aware of obviously Epic, Encore, Florence eBinders, eBridge, but all of the integrations that have been established with our research systems teams to help these systems talk to one another. It doesn't apply to all of the enterprise, but it applies to most of the enterprise. So in this case, we're highlighting Encore as that hub in the middle to help facilitate clinical trials, tracking your protocols and subject accruals. Encore has a direct link to Freighter Epic. We do not have a established integration with Children's Epic at this time, but with that, information can flow to and from Freighter Epic with patient demographic information coming into Encore. But then also when you put John Doe on a study, Encore will update Epic, update John Doe's record to associate that individual to a study and help facilitate those pieces. Encore also helps facilitate creation of binders and roles within Florence eBinders. There's a link between Encore and eBridge and Oracle. I won't speak too much about that because obviously everybody knows Workday is coming, and so there's going to be changes happening in that space. But with the integrations, Encore can also speak to both the Freighter and Children's public websites with what studies are available. So there's opportunity there to promote what studies are currently open for accrual. Encore's link to study payments. Again, I'll touch on all of these systems, but just wanted to show the web of how these systems are integrated with each other. And the one outstanding red arrow, it would be the next phase to help facilitate automated billing within Freighter Epic. So we're not quite there yet, future goals, but there's a lot of opportunity to let automation and let the systems do the work as opposed to manually doing those workflows. Highlighting quickly with eBridge, again, I think most people are aware eBridge is the system used for our funding proposals and for the PRO submissions to the IRB, as well as for IACUC for animal-related research. To register for account, I'm sharing the links in this slide deck, which will be shared with you, but it's a direct link that you register for an account. It takes about 24 hours and then you'll be set up with an account. And then training is available via the systems training on the research training website. There's a self-service prerequisite course for introduction to eBridge learning. So you can do that on your own, but then depending on your role, whether you're managing the PRO submission, if you're doing funding proposals, or agreements within eBridge, there's different opportunities to sign up for one-on-one guided training. So again, all of that's available on the training website. I have also put in the upper corner who the help desk or the go-to contacts for all of these systems. So you have easy access who to reach out to for help if you need it. With Epic, I'll be speaking primarily to Freighter Epic, but both Freighter and Children's utilize the Epic research module to associate participants to studies as well as encounters and orders to research studies. On the FNMCW side, the RSH or research record is created and maintained by OCRIC. And again, that creates that protocol shell, if you will, within Epic that you can then associate your patients to, associate any specific encounters, orders to that study, which then also sets the stage for future billing. Patient enrollment and statuses are managed via the integration with Encore. So again, if John Doe is on study and he withdraws and you update that status right away, it will update Epic accordingly. In order to get access to Epic, it's requested by your leader. If you have questions about Epic access, I can also help in that regard, but it should be with your department leader. For Epic training for research staff, there's two pathways. For non-cancer research staff, there's a prerequisite training via the Freighter Learning Center. There's a link there where, again, you can register and set up your own account. There's a lot of online training courses you can take and tutorials to walk you through some of the Epic functionality. And then also there's training with Charles Gray, who's fantastic. He's with the Freighter Clinical Informatics team. And again, he can walk you through some of those research workflows. Cancer Center staff, their Epic onboarding is managed by the Cancer Center training team. When it comes to granting monitor access to Epic, on the Freighter side, the study monitor will need to request Epic Care access via that link. They have to sign a confidentiality statement. And then it's really the coordinator then helps facilitate when a monitor needs access, that you can release that directly via the Epic research module, limited to the studies that you say who specific to that study, working with Freighter at HIM, to make sure that that monitor only has access to the study records they need access to and for the time frame that is required. Additional Epic tools on the Freighter side, specifically for subject recruitment. We have the ability to use My Chart for subject recruitment. There's a form on the HRPP website that you can include in your PRO smart form with a patient-friendly summary. I actually took the screenshot from my own My Chart account, but you can help or you can identify patients who may be eligible for your study and send them an invitation via My Chart to say, hey, you might be interested in a study. And the patient can say, yes, I'm interested, tell me more, and you can reach out to them that way. Or they can say, no, thank you, and that's where it ends. So I just wanted to put that out there. That's a tool available. If you have any questions, happy to answer those for you. In addition, we can use reporting workbench reports or best practice alerts to help identify patients based on your eligibility criteria. Maybe not your full eligibility criteria, but at least to narrow down the scope to identify patients in pre-screening who you might be able to approach for study participation. And then I also wanted to highlight our Care Everywhere SOP. I think there's always questions regarding the use of Care Everywhere. If you're not familiar, Care Everywhere, Epic allows the ability to link with other Epic sites. So I'll use the example of Aurora, that if, let's say, your participant who's a Freighter patient got in a car accident and went to St. Luke's, you might be able to see records from St. Luke's or other centers. And so we have a policy created around this. The Epic rules of the road, which again are Epic's rules, not our rules, but we have to follow said rules, is that use of Care Everywhere can't be used for research. So you can't be mining St. Luke's medical record for your patient. But if we have a patient who is receiving care here, and that care could be as part of a clinical trial, and let's say that patient, was in that car accident and maybe it was a result of an AE that happened from the study they're on. If it's related to their care here, there's an ability to access those records. If external records are pulled into our system, then they're okay to use. But I don't want to go down a slippery slope, but happy to answer any questions. But we established that SOP just to make sure that teams are aware of what is and is not appropriate with use of Epic from other centers. Moving on to Encore. Encore is our clinical trials management system. It's been in place at MCW since 2012. And really the system is used to manage research operations, to track your protocol information, protocol status, and then your subject enrollment on study. Encore is available to all MCW apartments. That includes pediatric studies. There's no cost for use. The only cost is a one-time CTMS fee if it is an industry-sponsored trial. And we have justification documentation for your clinical trial budgets. But other than that, it is available to use. From the previous map, it is integrated with a lot of our research systems. And so we're really recommending the use of Encore as a best practice to facilitate and utilize those automations that exist today. Again, there's no data mining in Encore itself. It's really to help sustain your workflows and track a participant's status across a study with a study calendar. We do have a protocol decision tree. If you're not sure whether or not your study should go into Encore, kind of the rule of thumb is anything other than a chart review can typically go into Encore. The Encore support desk email is also available if you have any questions, but Encore has a lot of great data reporting functionality, especially now we have Advara Analytics, which recently came on board, and you may start seeing some quality initiative efforts from the Office of Research as we're trying to reinforce some of those workflows within the system. For Encore training steps, if for new employees, the leaders would reach out and via the support training page can request a new account for new staff members. If teams are not using Encore consistently today, we would ask those units to reach out to the Encore@mcw.edu. And when it comes to trainings, Those are scheduled directly with Sandy Johnson on how to enter, protocol completion, subject entry, and then the calendar review process. So that, is a pretty straightforward process. And once you complete training, you have access to move your studies forward. Highlighting Encore financials briefly, for those, again, this is specific to studies on the FNMCW side. This process went live in July of 2023. And the goal of Encore financials is to help facilitate coverage analysis, budget development, and study invoicing, and eventually that automated billing. Again, the red arrow that was on that chart. So with that, Encore Financials has its own separate training path. All of those trainings are listed on our website, and we update them quarterly, so you can schedule trainings out. Total, it takes about 3.5 hours, but they are scheduled, multiple times during a month to learn the nuances of the system and what's available. But again, Encore Financials doesn't apply to pediatric studies at this time because we don't have that integration with Children's Epic. But for FNMCW, Encore Financials contains a research charge master. So that includes pricing for both rater technical fees as well as MCW professional fees. It includes true fees, CIR fees. I like to call it the patchwork quilt because we truly sew all these pricing together and update it on an annual basis. But when you're looking for pricing, Encore Financials is a great tool to give you that information. And again, our team, Encore Financials at mcw.edu, is happy to answer any questions. Florence eBinders is probably my favorite one to talk about. This went live in 2021. Unfortunately, we didn't have it in time for the pandemic because it would have been really great when everybody was working from home and all your reg binders are here. But the images on the right-hand side, Florence eBinders is basically a cloud-based repository for your regulatory records to get rid of the rooms and shelves and file cabinets of research records that we know exist all over campus. It eliminates the need for long-term storage off campus because it's all based on the cloud. Florence is Part 11 and HIPAA compliant, so your patient records can also go in there. I think the piece that study teams find most beneficial is the ability for electronic signatures, so you don't have to helicopter and wait and find your PI to find their signature. You can send it to them, and if they're at a conference across the country, they can sign it at 2 a.m. if they want, and have that document signed and ready for you the next morning. So because it's Part 11 compliant, it does have the ability to certify a document, which allows the elimination of wet ink signature documents, and that includes consent forms. I know that makes some people nervous, but when space is at a premium, you could have the ability to take John Doe's signed consent form, scan it into Florence, mark it as a certified copy, and that truly becomes the new original. And you don't have to retain the paper version anymore. The IRB policy covers that. And again, I know it makes people's hearts flutter a little bit, but it does allow for that piece. Probably also most beneficial, it facilitates remote study monitoring. So your monitors, wherever they are in the world, can have access to your study records, and they don't have to travel on site, and you don't have to do kind of over the shoulder monitoring in that way. As previously mentioned, it's integrated with Encore, so it helps with the study binder and team access. And again, it's available for all studies approved by MCW IRB. It's free for use. Again, similar to Encore, only in the event of industry sponsored studies, there's a one-time fee. And again, they're saving a lot of money not having to send their monitor here. So that fee just helps pay our annual bill. But Florence eBinders has been great. I think coordinators have said it's really a tool that helps them in their daily workflow. So training is self-service online. For coordinators, it takes about an hour and a half. For investigators, it's about 15 minutes. But once everybody's in and you make that commitment as a team or as a study to have your information in Florence eBinders, people have found it really helpful. So Again, if you have any questions, feel free to reach out to me via the florence@mcw.edu, or there's the Florence Toolbox on the training page. Lastly, I believe is the payments card. If you're not familiar with the payments card, it's a basically MCW branded Visa gift card. It looks exactly like the image that allows participants to use it wherever Visa is accepted. And it has the ability to quickly load payments to the card with a secondary approval to ensure that the charges are correct, if you will. It can be used for both study stipends as well as for subject reimbursement. And it saves the time and effort of taking care of processing paper checks, or if you're using physical gift cards, not everybody goes to Target, not everybody goes to BP. So it gives a lot of flexibility for both study teams and for research participants. Again, it's free to use. You don't have to be an Encore to use the payment system, but the integration between the two systems really does help facilitate that information to flow from Encore to payments. And then again, I have the link for the payments website, and study coordinators can sign up for user access and training. And then with your department approver also in place, you can utilize this resource, which has been great. I also just wanted to touch very briefly on OCRIC. OCRIC is the Office of Clinical Research and Innovative Care Compliance. Our partners within Frederick Hospital. I think most are familiar, but for any studies that are involving Freighter space, Freighter resources, Freighter patients, does require OCRIC approval. And so I just wanted to make a quick note of our OCRIC partners because they help facilitate some of the Freighter pricing requests, coverage analysis, some of the operational feasibility, identifying the who, the what, the where things are happening within Freighter spaces. So make sure to connect with your nurse consultant and OCRIC team when you have new studies coming down the line. I know there's been previous misconceptions. Oh, I don't submit to OCRIC until after I have IRB approval, and that's absolutely not the case. You want to make sure OCRIC's aware of your study before you submit to the IRB, so things can flow in tandem and help speed up your activation at the end. So again, OCRIC's a fantastic resource and a great partner to study teams. So please reach out to them if you have questions regarding conducting any study within Freighter. And that is it for me. So I'm going to turn it over to Isabella to take on and talk about research on children's.
Thank you. For anyone who's not familiar, I work in the Pediatric Translational Research Unit. Part of my role is providing operational support for things happening in the PTRU space, but I also help support our research teams that either work in children's spaces or engage with our patients for kind of centralized support and education. So when we think about systems at children's and education, really most of our systems training is going to be encompassed into our core series. And this is a newer offering that we have as of January. But the core series consists of 3 sessions. So we have Children's Foundations, Operations, and Research Oversight. And across these 3 sessions, we'll have all of the children's specific systems training. So things like Citrix that grants access to Connect, Epic, and then also our requesting access and then billing and claims management as well. So prior to receiving training on any of those systems, systems access is requested by having that new staff member get registered in CW Workday, either by CW leader or the CSG administrative team. To facilitate this request, we have a request for system access form for research purpose, and that gets submitted to Maria with our research compliance. And that form can be found in our Q drive, which you can access through Children's Citrix. After Maria essentially vets the request, she passes it on to our health information management team, and then you'll have pretty much full access to our children's systems. One of our main children's systems is Children's Connect. And for anyone who's not familiar, it functions similarly to InfoScope, with the added caveat that it's going to house a lot of important hospital-related policies. So things pertaining to our lab services, infection prevention and safety. So a lot of Joint Commission resources we have in there, as well as patient experience. Again, our MCW and varsity staff will have to access Children's Connect through Citrix, which you'll receive when you get your systems access. And aside from any hospital-specific policies or resources, we also have a lot of CW research-specific resources. So our CW HRPP has a ton of nice SOPs, resources, and other guidances that are saved in Children's Connect. And they often will link to other related policies. So it's really important to be able to access Connect and navigate it. When we think of training, like I said, this is covered across our 3 sessions. During the foundation session, a big focus is, again, just on understanding the hospital policy, just because whether you're a contracted employee or not, we want everyone to be compliant with our hospital-related policies and procedures. During that second session, we do cover more of the technical aspects of how you might use Children's Connect in your daily roles. So our lab test directory, which has information on all of the local labs that we have at Children's and any testing constraints, things like that. We also have an imaging test procedure directory, as well as a special studies database. And these are all nestled within Children's Connect. And the special studies database will house information regarding processing research samples for our research studies. So this is more technical applications of Connect. And then during our third session, the research oversight, that's where HRPP will dive more into our research-related guidance and policies that we have, and things like the HRPP SOP manual, which you can find in Children's Connect. So another aspect of systems training that we have during the core series is EPIC. EPIC is a bigger topic during these sessions. So again, during Children's Foundations, we have more of kind of a basic overview of EPIC. So this is really designed for a research staff member who maybe has not worked in healthcare previously or is not familiar navigating EPIC. And all of our EPIC training is led by Jeff Crawford, who is our EPIC guru on the children's side. So during this first session, he'll cover general navigation, patient station, chart review, just essentially different ways to get into the record. And then operations will have more of the technical component, so our research study maintenance and study enrollments. And I will cover this more in detail because our process does differ slightly from that on the adult side. And then our third session will cover advanced research EPIC. So this is a little bit of a longer session, but we have things like smart phrases and notes, reporting tools. So he'll touch on Slicer Dicer, and then dashboards and learning homes. So this is our kind of third and final EPIC related session. Essentially, when new staff have went through the core series, they are able to perform all of those EPIC tasks either independently or semi-independently. And I'll kind of touch on some of these that are more semi-independent. So for protocol setup in EPIC, how this works in children's is after IRB approval is received, our teams will initiate the protocol setup by making that initial shell. So that shell will include basically just the study ID, IRB number, so that PRO number, general study information, and then users and providers that should be added. After the shell has been created, then teams will contact Jeff Crawford again and schedule a meeting to finalize that protocol setup in EPIC. And this really ensures that from a billing perspective, we're all good to go when we have that first enrollment. So having Jeff kind of give it a once over is always very helpful. The other EPIC related process that I want to touch on that just is slightly different here on the children's side is granting monitor access to EPIC via the EPIC Care link. So probably somewhat similar. Step number 1 is we're going to have that monitor sign a confidentiality statement of understanding. This agreement is found within one of our children's policies. It's the privacy, confidentiality, and patient information policy. So again, that'll be found in Children's Connect. And anyway, within that policy, there are two different statements of understanding. And one of them is for contractor and temporary personnel, and that is what our monitors would sign. Essentially, we forward that form onto the monitor, we get their signature, and then we need to have our study teams retain that signed copy with their study files. And that signed copy doesn't get forwarded on to HIM, but they will ask you to confirm that you did have it signed. So it's a box that you tick in the actual form. And again, we have the path or the breadcrumb here for where to find that policy in Connect. After you have your monitor, after you have the monitor's signature, then you'll submit one of two forms, either a new monitor request form or a recurring monitor request form. And it's just dependent on whether they have already previously been granted children's EPIC access. If you're not familiar, you can submit a new monitor request form, and HIM should be able to assist. One of these two forms will get sent on to our HIM contacts, Stephanie and Michelle. And again, these two forms are also found in Connect in a different location. They're not within a policy, but they'll be in our HIM resources, and I have the breadcrumb there as well. Again, that statement of understanding only needs to be signed once per monitor. And again, very, very important to maintain that with your study files, just in case for audit purposes that we are able to have record of that signature. One additional note, because I noticed in Jen's segment, she touched on the timing. After talking with our HIM contacts, they do actually prefer a 2-week lead time for those new monitor requests. I think they can facilitate it sooner, but I think just for courtesy for them, they prefer a 2-week lead time. I do know they can facilitate the recurring requests much faster. There's less on the background for them to do, but just a reminder for that. All right, and the last kind of EPIC related process that I'll touch on is our billing and claims management at Children's. So really the first step with respect to billing and claims management that's children specific is all of our new studies need to have a CW billing plan submitted. And this gets reviewed by our research compliance. So again, Maria, prior to our eBridge submission. And really Maria, Teresa Kump, and then primary coordinator kind of work together to finalize this billing plan and make sure it's all set again prior to eBridge submission. Again, any research activities that could or will incur a charge should be listed in that billing plan, and also noting who will provide what service and where things will be happening. So again, from a compliance perspective, we can make sure that everything is set and all of our ducks are in a row prior to even submitting that study. On the compliance end, they will provide charges and CPT codes if they're needed for any of those research activities that could incur a charge. Now, if we fast forward to when the study's up and running and we have a charge that needs to get removed, the process is still a little bit different on the children's side as well. We have a charge notification form that gets completed and then emailed to our research billing contact. And that needs to happen within 24 hours of that visit to prevent those charges being routed to insurance. And really having a solid CW billing plan makes the charge notification submission process much smoother. And we really want that billing plan to be like a living document that teams reference as they enroll patients. Again, this training is covered during the core series, specifically the research oversight session where we have Teresa Kump as a speaker, as well as Lori and Michelle with HRPP. So lots of great information there. I do have excerpts shown here on the left-hand side is an excerpt from the research billing plan where you can see it's essentially a schedule of activities with more, site-specific information about who's doing what. And then on the right-hand side, we have our charge notification form that gets sent to our billing department. These are both saved in the Q drive, which again, you would need to have children's Citrix access in order to access, but these permissions are built into, everyone should have access to this file folder essentially once they get their children's access. And if you ever have any questions, you can reach out to Maria and she can help with that. Really, the last thing that I'm going to touch on today, I know Jen provided a really nice overview of Florence. The only caveat that I want to add from a children's perspective is within that central resources binder, there is a PTRU subfolder, similar to if you've went in and looked at the adult TRU documents. We do have, we definitely do have TRU specific guidelines and scheduling information and resources. But I also want to emphasize, even if you don't necessarily use the TRU space, but you either engage with children's spaces or patients or work in children's spaces, there are other just more research organizational type information. So general information on order coordination or research collection best practices, things that are specific to children's and not necessarily the TRU, but it's a great central place to house that information. Just knowing that our MCW staff can access Florence without citrixing in to Children's Connect or to another environment. So we also do there have systems related resources like EPIC guidance documents from Jeff. We have some duplicated, resources like informed consent processing, labels and guidances. Again, just another space to access some of that information. So if you ever work on the PED side, I highly suggest just skimming through that folder. And we do, I would say, add new things on a monthly basis at least. That brings us to the end of our slides. I recognize we recognize it's a lot of information.
Yeah.
So we just want to emphasize there are tons and tons of resources that are available to everyone. But with that, does anyone have any questions?
Well, people are coming up with questions, just to echo what Isabella said, and I didn't mention regarding Florence. We do have that central resource binder, not only for the PEDS TRU, the A TRU, the IRB rosters, the standardized labs for both children's labs, Freighter labs, the CAP and CLIAs. So a lot of those regulatory documents or resources that you need for startup that your sponsors or monitors need, they also have access to that information. So, again, feel free to check out in that central resources binder, what's available. We try to keep it as current as possible. If some of it, if like, hey, the CLIA's expired, let me know and I can update that. But, if there's things that you'd like to see that aren't in there yet, again, let us know and certainly we can make that one-stop shop, because we know Infoscope can be a black hole trying to find information. But again, you also then don't have to provide everything to your monitor. They have access to be like, here's the URL. So just knowing that that's a resource for you.
So that's in Florence.
Yep. There are 2, I believe, or 3. But central resource folder.
It's a good one.
Even, in the post-COVID world when, tours of IDS pharmacy, tours of the A TRU, P TRU. So there's video links in there that you can just share that with your sponsor. They don't have to physically come here for a tour. Here it is.
Yeah, you can shortcut it to your
Yep.
study binder.
Yep.
I know in the PTRU side, we also have equipment. I know this is maybe outside of the scope of what we're talking about today, but we have all of our equipment logs and calibration records all in there. So you can link them directly to your study e-binder if your sponsor ever requests them.
Can you elaborate a little bit on the certified copy of a consent form, like that it becomes? So ours is a database. My study is basically we're building a database for patients to participate in research, and I'm running out of space in our offices with our binders.
Yep.
And we do keep them in Florence, the copies. How does that mean that we don't have to send our binders off to a different place to store them then?
100%. So the most important piece when you are certifying a document, and it's the same workflow as if you're signing it. So when you go to sign something and, pick your choice of acknowledge, approve, what have you, one of those options is certify. And a disclaimer pops up that by certifying this document, this becomes the new original. And so if you're scanning your consent forms in and you go in and certify them, you can get rid of the paper. You can always just a note to file, just as a, but yes, then you don't have to pay for offsite storage. You don't have to, take up file cabinets all over the place, especially as studies age out. It's like, what is all this? I'll use the example with the building of the new cancer center building. Actually, our IACUC office, the animal research office they were losing space where have required documents that they have to retain. They got everything scanned into Florence. They have a home for it and marked it certified, and they were able to get rid of all of their previous paper records.
Is there a specific way, aside from putting it in the bin, for papers that you want us to get rid of these documents? The original copies?
Oh, you mean like in a PHI bin or?
Yeah, just that.
Just
Fine.
like-
Okay. Just thinking.
It feels
No,
weird,
like,
right?
want you to shred it or something.
Yeah, it's
It
nerve
feels
wracking to be
weird,
like,
yeah. Yeah.
throw this away,
Yeah.
but, or, but having it destroyed, but, as long as it is marked certified, it is the new copy. So same, if you have a worksheet and you're collecting vital signs, or, a PI makes a physical written note, and you want to retain that, you could scan it in, mark it certified, and get rid of that little piece of paper. So, but consent forms are the most.
Yeah.
But, yeah, it's an option.
That's awesome. Okay, thank you.
Just came in on the chat. It says, I have 2 studies that have been enrolling for 15+ years. Can I use Florence to just store the consents?
You sure can. You sure can. And, I'll also highlight, it was years ago, I did a little ask and tell the president to Dr. Raymond. Florence can be used outside of the clinical research world as well. So we have a couple departments who have department folders. So rather than a SharePoint or G Drive or wherever things live, they've created, I know Cancer Center has, OB-GYN does, Peds Hemonc has one, so if it's your onboarding, if it's training, if it's, all those things, like we can create a place for you. It's, everything in Florence is based on access. And so it's just determining who gets access and what level of access they need. But you have an audit trail that you can see what people have looked at, downloaded. So, it's intended for clinical research, but with the functionality, and Florence is okay with that too, that if it's just a need to eliminate paper files, the hard part is scanning everything in, but, once you do, it has a home. So then you're not paying to ship off a box never to be seen again. So. Yeah, was that Catherine? Where did that question come from?
Kathleen Muskin.
Kathleen, if you want to touch base, happy to touch base about your studies.
Any other questions?
Again, don't try and find the solution on your own if you're struggling to like, where is this from? Check out the research training website. We try and keep it up to date. If there's things that are old or don't seem correct, let us know, but, it does have a lot of the necessary information, especially with, for newer staff members. Or as a refresher for, seasoned coordinators, but, again, there's lots of people around to help. And we can connect you with the right folks to point you in the right direction.
Excellent. Thank you so much. Thank you, everybody, for being here today.
Thank you.
Thank you. There were a few thanks in the chat as well.